Hello, and thank you for joining us today to prepare for virtual RLS Advocacy Week. Today, we are focusing on advocacy, ensuring that all advocates have the tools and answers that they need to successfully contact Congress. With us today is the Foundation's Washington representative, Philip Goglis II, to give us a look forward at 2022. Thanks for being with us today, Phil.
Thanks, Clara. It's good to be here, and thank you to all of our advocates for participating.
Awesome. Let's dive into the questions. So first question is, what is coming up in the next year that advocates need to know about?
So we are in a midterm election year, which means that the whole House of Representatives is up for election and a third of the Senate is. So what we're going to see this year is a lot of just the politics of Congress and in terms of an election being waged this year, and you'll see different sides trying to highlight key things that they've done and working to earn your votes in November. But what we can expect besides that is the Foundation's continued push and focus on our advocacy efforts. We have been very successful over the past few years in engaging and raising awareness on Capitol Hill about restless leg syndrome. We've had very meaningful conversations with federal agencies such as the National Institutes of Health and their specific institutes who manage research into RLS. We've worked on creating new federal programs such as chronic disease education awareness at the Centers for Disease Control and Prevention. So there's a lot of good work that we've done. There's a lot of important outreach that we've had, raising the importance of supporting our priorities with House members, with Senate members, and developing our community into strong advocates who are able to engage with their members. So some key things for this year is we're going to continue with our virtual advocacy efforts, as you all know, as we're, having these videos for Virtual Advocacy Week. So it's critically important for all of our advocates to participate, engage with their members and senators to develop those connections and those relationships as we continue to build on our advocacy successes. We also, throughout the year, will be keeping everybody up to date on any timely items as Congress works through their legislative agenda before the end of the 117th Congress. And of course, we know that in any election year, there's going to be a lot of turnover in terms of members who are retiring or will not be back in January. So we are going to be focused on increasing our relationships and preparing for the new Congress that'll be starting in 2023 with a lot of new members, which gives us a great opportunity to expand our education activities and our awareness activities and develop new champions. So as I've said in other videos, we can't do all that we do here in Washington if it's not for you, the advocate. So thank you for all that you do, and stay tuned as we go throughout the year and different items that we're working on, we get engaged even more in to finish off before the end of this Congress.
Awesome. Super exciting. Let's see. Question number 2. Can you remind us briefly what our key priorities are?
Sure. So we as an organization are incredibly focused on increased NIH funding, which is critically important because it allows more research to be done into RLS. We're also very supportive of the Department of Defense's peer-reviewed medical research program that has a dedicated set aside of funds for our researchers to be able to apply for grants and to compete for funding into sleep disorder and restrictions in terms of how RLS affects servicemen and servicewomen who are active in our military. We also are supportive of a chronic disease education and awareness program at the Centers for Disease Control and Prevention. And what that does is provides the opportunity for organizations to partner with the CDC to increase education and awareness activities among the medical professionals and within the general population to better understand what is RLS, how to find quality care for RLS, what critical resources there are for patients, caregivers, and family of the RLS community, and how to ensure that all of the good work that's being done at NIH and the new research and the new discoveries are being translated to the general population so everybody has a great understanding of the state of the science and where everything is. We also are very active in ensuring that Congress is aware of the importance of access to treatments for our patients. We know that many utilize very low dose amounts of opioids to treat the underlying nerve condition that's associated with RLS. So we're very active in educating not only Congress, but federal agencies about the importance of distinguishing not only RLS from chronic pain, but ensuring that the government does not get into that patient-doctor relationship where, if you have for years been on a treatment regimen that your doctor has prescribed, and that it works, that no third party, whether it be the government or insurance or anything else, steps in and says you're no longer able to utilize that. So we continue to use our voices to elevate the importance of these priorities. And we are very thankful for all of you who are participating in raising this awareness and education. And we implore you to continue this throughout the year as you receive updates about the work that we're doing here and across the country when it comes to advocacy.
Great. Last question. What can we expect to see in this coming year?
Well, we are hopefully starting to finally turn the corner here on the pandemic and are seeing a sort of start of reopening. So we're hopeful to be back on the Hill in person within the next year or so. It may not be in calendar year 22, it may be in 23, but we are looking to get back to our pre-pandemic activities, still while monitoring what's going on, but being able to engage more on Capitol Hill with staffers, have in-person meetings again, have that opportunity to engage with folks to discuss support of our key priorities that we have discussed. You can also expect to see a lot of activity from the foundation in terms of what we're doing with our advocates to increase participation, to again, educate and elevate the importance of RLS. As I've mentioned, with it being an election year, there's going to be a lot of people who are going to be running for office, who are going to be active in the community and trying to engage with their constituents. So it's a great opportunity for everybody to make those local connections and to develop those key relationships that will prove beneficial as Congress continues to move on and as we work to further cement the priorities that we support. So strongly encourage everybody to stay up to date with the work that the foundation is doing. Stay tuned for how you can engage and become more involved in our efforts. And we look forward to having you. And again, thank you very much for all the work that you all are doing on behalf of the community.
Awesome. Well, thank you, Phil, for sharing your time and information with us today on how to reach out to our local representatives and how it's so important to be an advocate in this coming year. You can watch more of our advocacy videos on our website underneath the Get Involved tab and on YouTube. Thank you so much, Phil, and I hope you have a great rest of your day.
Thanks, Clara, and thanks, everybody.